Atrial flutter is an arrhythmia that develops because of a conduction defect in the atrium. What makes it stand out is the rapid, regular impulse that races through the atria at a rate of 250 to 400 beats per minute. Now, if every one of those impulses made it through the atrioventricular node into the ventricles, the ventricular rate would also be 250 to 400 beats per minute, and that would throw the heart into ventricular fibrillation, a rhythm that is immediately life-threatening. Luckily, the AV node has a protective quality here, blocking some of those impulses. This therapeutic block is a key feature of atrial flutter. The risk factors are much the same as those for atrial fibrillation. If you picture the ECG, the atrial rate runs between 250 and 400 beats per minute, while the ventricular rate is usually between 75 and 150 beats per minute. The atrial rhythm is regular, and the ventricular rhythm is usually regular as well, though sometimes it can shift if the AV conduction ratio changes. The QRS complexes are typically normal, though they may look abnormal or even be absent in some cases. Instead of normal P waves, atrial flutter produces what we call flutter waves, or F waves. These have that classic sawtoothed pattern, which is one of the easiest clues that you're dealing with atrial flutter. The PR interval is difficult to measure because of those multiple flutter waves, and the P to QRS ratio may be 2 to 1, 3 to 1, or even 4 to 1. Atrial flutter can cause serious symptoms. Patients may present with chest pain, shortness of breath, or low blood pressure. When that happens, treatment is needed. Medical management can start with vagal maneuvers, similar to what we use for sinus tachycardia. Another tool is intravenous adenosine, given rapidly and followed by a saline flush. Adenosine briefly blocks conduction through the AV node, which may stop the arrhythmia altogether. But even if it doesn't, it often slows things down just enough to make those flutter waves more visible on the ECG. In terms of long-term management, atrial flutter is treated much like atrial fibrillation. That means antithrombotic therapy to reduce clot risk, rate control to keep the ventricular response manageable, and rhythm control to restore and maintain sinus rhythm when possible. Electrical cardioversion is often successful in converting atrial flutter back to normal sinus rhythm. So to summarize, atrial flutter is a fast, organized atrial rhythm with sawtooth flutter waves protected by the AV node from becoming immediately fatal. Recognition on ECG, awareness of symptoms, and knowing the key management steps. Vagal maneuvers, adenosine, antithrombotic therapy, and cardioversion are essential in caring for these patients.